Dallas is going to kick us off with a question.
Hi, Victor. Great question. So my screen's off because I'm feeding my son. And so I really have I think it's really interesting how they have Chinese medicine as one of the, I guess, drugs that are given. Can you give an example of what that would entail?
So I'm not exactly sure what the exact treatment was, but the traditional Chinese medicine are just kind of things that in their culture they consider to be medicinal, and that patients are sometimes given within Chinese hospitals. So I'm not exactly sure like what they are specifically, but that's just something that they consider to be medicinal.
Yeah, I think that's really interesting how like cultural things play a role in like medicines that people take.
Definitely, yeah.
Yeah, I've also heard that there's a lot of sort of culturally related diabetes treatments. You know, something's related to like turmeric and cinnamon and things like that, depending on which culture you're coming from.
Right.
Speaking of region, I'm wondering, do we know if the rate of diabetes in the areas where the study was performed is at a different rate, or I guess absolute number even, than, you know, what we are seeing in the United States? Because diabetes is like a huge disease here. Is it as big in China?
Sorry, did you say diabetes or COVID-19?
Diabetes.
Diabetes, I think, is more prevalent in the United States than in China.
Yeah.
Just
That's so interesting.
Yeah, when you adjust for a population.
Yeah, and so I wonder, do you think that with, you know, if now we're going into speculation mode, with the ideas around, like, so we have higher rates of diabetes here in the United States, and, you know, we're not controlling COVID. I mean, do you think that like the extensive death rate that we're seeing here compared to other places is in part because of some of these comorbidities, or do you think it's more related to like mismanagement of like, you know, social distancing or testing or things like that,
or even health management?
Yeah, absolutely. I think it's definitely a combination of all those factors, but I definitely think since we do have like a much greater incidence of type 2 diabetes, specifically in the United States, I do think the reason why we're seeing so many deaths and severe outcomes in the United States is much higher. Again, because we have these communities of color which suffer from type 2 diabetes at much higher rates than many people in the world. So that definitely could be a major factor in why we're seeing so many deaths and severe outcomes in the United States. Yeah.
Cool, thanks.
Yep.
Awesome. All right, so we have a question from the audience. So the question is, have these results informed early treatment of people with type 2 diabetes or COVID-19? Are they trying to get blood glucose under control while treating for COVID-19?
I'm so sorry, could you repeat that question?
Yeah, so I think they're wondering if the results from the paper are informing on any early treatments for people with type 2 diabetes and may become infected with COVID-19. That's the first part. And the next part, like, are they trying different things like keeping your blood glucose under control while treating for COVID-19 based on the results of the paper?
So to address the early treatments question, so from these results, I mean, they are advocating for basically just in general better control of your like blood glucose if you're diabetic, just because COVID-19 is spreading through the world so quickly. Sorry, could you repeat the second question?
Are they trying to get the blood glucose under control when people with type 2 diabetes get hospitalized with COVID-19? I don't know if that can help, like, in the moment or.
Right. Yeah. So yeah, one major, they did advocate for that, but again, a really big limitation of the study was that it was retrospective. So they couldn't actually follow if making their blood glucose better would basically make their COVID condition better over time. So that's why doing a kind of a prospective study would really improve these results. But they do still say that they believe that for a patient that's hospitalized for COVID and that has type 2 diabetes, one thing that definitely could help would be to manage their blood glucose in real time.
Cool. Yeah, that's probably pretty critical. So what about, you know, diabetes has its own set of comorbidities, right? You have lots of heart disease issues related to the diabetic kind of milieu, as they say.
Absolutely.
So how, you know, were there any kind of indication in terms of like the presence of cardiovascular disease or specific demographics like age or other types of medications that they're taking that maybe not related to diabetes? Was there any indication that patients were, you know, I guess, was there any summary of like patient history and how those factors could have also impacted outcomes? Or did the paper not go into that?
So the paper did go into it, but for the really big results where the graph that showed the survival rates, they actually adjusted for other comorbidities like heart disease, like liver disease. So they kind of tried to only focus on diabetes, although they did mention that those kinds of conditions and comorbidities typically come with type 2 diabetes and are present in people who do have type 2 diabetes. And they do say that these factors definitely can impact morbidity, but that wasn't like the focus of their study. Okay.
Cool, thanks. And that was from Peggy from Facebook. So thank you for asking that question.
And similar to the first question I asked, are you aware of any measures that China has implemented in response to this paper in ways that they can promote or better manage type 2 diabetes in their population?
So I'm not actually aware, and this paper is pretty recent, but I can imagine that since they used like all of the patients that had COVID-19 in this particular province, that they definitely are probably using the results from this paper to currently treat individuals who have COVID-19 and type 2 diabetes. Although I'm not exactly sure.
Cool. So we have a question from Susan, who's one of our Rocky to You moms. So hi, Susan. Thank you for your question. Why was the group limited to ages between 18 and 75?
So the reason they limited the cohorts in the delineation of age basically is because, so first, for individuals who are above the age of 75, these individuals typically have a bunch of other kind of conditions which could actually be confounding factors for this study. So those individuals were eliminated. And then people who were under the age of 18 could also have a lot of these factors, but also I would imagine that there must be some law for individuals who are under 18 to not be able to
consenting.
Consenting,
yeah. I wonder, like we have in the United States the age of 18 as like the sort of that barrier between child and adult. Is that a universal age across the world? That's something I actually never thought about.
In some places, I think it's 16 in certain countries.
Okay, interesting.
Yeah.
So I wonder what it is in China. I'm ignorant when it comes to that stuff, so I apologize.
Yeah, I'm not sure either, but I think the main reason is because these ages could like represent confounding factors in the analysis of the data.
Yeah,
good point. Another question, do you think, or is there a difference in the lungs of people with type 2 diabetes? And I think this is pointing at the fact that COVID-19 seemed to inflict on lung cells more than other cells in the body.
Yeah, so they actually did talk a little about this in the paper, saying that individuals who have really advanced type 2 diabetes, particularly the individuals who have the poorly controlled blood glucose, often have damage in their vascular systems as well as in their kind of related lung systems. So the paper does mention that they think that's actually where the comorbidity for the respiratory illness comes from, is the degradation of kind of like vascular as well as respiratory systems as a result of diabetes.
Interesting.
Cool. So we have a question from Chloe, who was a D4P fellow, won 3 sessions ago, if you're including this one. So welcome back, Chloe. Thank you for joining. The question is, did all type 2 diabetic patients receive the same standard care for COVID-19? And if not, did the survival analysis showing differences between the well and controlled patients account for that?
So the treatment was very uniform for just COVID-19 patients in general, but the differences came when the patients had severe outcomes. So if, for example, they had the ARDS syndrome, which was the acute respiratory distress syndrome, then they, of course, had to have different treatments than did other patients. And they what they did was they didn't compare directly patients who basically didn't have like the same treatments. So they kind of like delineated it in that way to kind of remove that as like a confounding factor. Of course, you can't remove all factors that confound the analysis, but I think they tried their best in that regard.
Mm-hmm.
Cool. Great.
And question for McKenzie. So can you talk more about why poor BG, blood glucose, control exacerbates COVID-19 from physiology perspective?
Yeah, so there are really a plethora of reasons. So when you have really poorly controlled blood glucose, it means that you're either not getting enough insulin or your condition is maybe really advanced. So in this case, a few things can be happening. So as a result of like all the glucose in your blood, again, it can cause a lot of damage to your vasculature. It can cause damage to your nerves. It can cause a bunch of damage to multiple organs. And then, of course, since the cells aren't getting enough glucose, there can be like a huge like chemical cascade where a bunch of issues can occur just because a lot of like processes that typically will be occurring won't be occurring. So then, as a result of all this, a bunch of different diseases can manifest actually from type 2 diabetes, like I mentioned, like liver disease, kidney disease, and stuff like that. Mm-hmm. And then what happens then is kind of like a bunch of things happen, but then your immune system can also really become compromised, and we know that from that you can have really severe outcomes from COVID-19. Yeah, and in general, the answer is there's a lot of reasons, but I think the main reason is just because your systems basically just start failing, and then your immune system is compromised, and then you're just more susceptible to severe outcomes from COVID.
And I think
go
ahead.
Along those lines, do you think medication might have anything to do with that? Like, so people with type 2 diabetes are taking medications that might alter certain other aspects in the body.
Yeah, I definitely think that is a factor for sure. However, I'm not really exactly sure about the specifics. Although the study did show that even though the poorly controlled blood glucose group were given more medications, they did survive less than the well-controlled blood glucose group. So I'm not, yeah.
I think we're going to end with one last question from Aditi. Thank you for joining us once again. So happy to have you back with us. I think you might have the frequent flyer card for D4P at this point in time. I think one day maybe we'll get you a free coffee out of it, or ice cream. So her question is, since this study and others concerning COVID-19 have been performed in China, how are the results or implications being interpreted in other nations? And are other nations taking actions to specifically address populations with type 2 diabetes?
Yeah, so since this study was performed in China, obviously there are certain cultural factors and certain community factors which could definitely affect the results. But in general, I think since the study was so rigorous and it was performed on such a humongous cohort, again, it was like 7,000 total patients, I think it's being interpreted pretty generally all over the world. Although again, as I mentioned, certain communities, like communities of color, which disproportionately are affected by both type 2 diabetes as well as COVID, may have like unique factors which affect their comorbidities. So certain aspects of the study may not apply to those communities. But I do believe that similar studies like these are being performed in the United States, in these particular communities, and all around the world.
Yeah. I think it's really interesting when you mentioned it's not really having type 2 diabetes, but whether or not it's being well managed. And I
Right,
think
Yeah.
some of the issue here with some of those communities is that, access to healthcare is a big thing. So
Absolutely.
getting the medication to control can
Absolutely.
definitely impact that.
Yeah.
Or like the price of insulin here in America, it's just out of control,
Absolutely,
and so all of these things, I'm sure this is going to be a very messy data set coming out of the United States, I think, when we look
absolutely.
at this type of data for us.
Yeah.
Just another reason why the American system needs an overhaul.
Right. Yeah, and I think the data in the United States is going to be so high dimensional because there's just so many factors, social, like economic, biological, obviously, that kind of play into this issue. So I think it's going to take a lot of really good analysis to kind of like figure out what the exact causes really are.
Yeah, I think makes the data really messy. And I'm thinking about a time I went to an international conference, and a lot of their like researchers don't even ask or mention socioeconomic status because that's not an issue in their country.
Yeah.
And it really highlights I think the system in the United States especially.
But I actually don't think I think socioeconomics is an issue in every single country. It's that there are cultures that are more comfortable ignoring it than others, and I think United States definitely falls into that. We're very uncomfortable talking about it. And this is everybody likes to be in their little bubble of privilege, and I think we really need to start dismantling that. So
definitely. And addressing the issues head on.
Yeah. And I think, Leanne mentions we all agree that reducing type 2 diabetes is a priority. Of course it's a priority for everybody. This is definitely one of the big, this is a pandemic just in a different way, So.
Absolutely,